Hello, my name is Dr. James Walters and I'd like to welcome you to Cardiff University's online MSc in Psychiatry. It's my pleasure to introduce the course, which started in 2011, and in September 2012 the second intake will go ahead, and we're looking forward to having many more students on the course. All the information you need about the course is available on this website, including links to the course prospectus. So for now, I'd just like to show you how the course looks. The course is accessed online through Cardiff University's virtual learning environment, Learning Central. The course material is divided into 5 areas of knowledge and skills. The teaching, like the practice of psychiatry, is centred around the clinical assessment. For each unit of study, we present a series of short interviews which demonstrate good practice.
Were there any biological symptoms evident?
Yeah, okay. His sleep isn't very good. He's getting up quite frequently in the night and pacing around. On one occasion he got up and got dressed and said it was morning and tried to go out the house.
And ask the student questions related to the clinical skills of the psychiatrist. Then we move on to basic sciences that underpin the practice of psychiatry and include neurochemistry, psychopharmacology and psychology.
It only binds the receptor when the magnesium ion has already been displaced and the receptor is open. However, because it has relatively low affinity for the NMDA receptor, following an action potential which causes the release of a large amount of glutamate into the synapse, memantine is displaced and the NMDA receptor is activated and allows calcium ions to flow through.
This is followed by diagnosis, where we teach the clinical features of mental illness, illustrated with simulated patient interviews.
Dress and she pokes me, and I'm in bed. I shout at her. Shouted at the men, but they don't take any notice of me.
Okay. So is it every night?
No.
She tells me if she does, but it's not every night.
No.
Thankfully.
Patient management is mainly taught by interactive video discussions between a senior doctor and their junior staff.
Yeah? What kind of seizure would it be?
Well, because he retains some sort of level of awareness, I think it would probably be a partial seizure.
Partial seizure, right. Okay. Any particular type of partial seizure you're thinking?
Well, he did some sort of complicated things while this was happening, so maybe a complex partial seizure.
Complex partial, yeah. And how about that scratching? What did you make of that?
And finally, we teach the principles of evidence-based medicine and scientific methodology, highlights of which are based upon the research into the genetics of schizophrenia, bipolar disorder, Alzheimer's disease and ADHD, which is carried out by our world-leading MSc Centre for Neuropsychiatric Genetics and Genomics.
The genes that have been identified can explain just over 20% of cause in Alzheimer's disease. And if you're just looking at the genetics, they explain about a third. So we've found about a third of the genes that contribute to Alzheimer's disease.